practices. I know that I'm sure you're going to increase penetration of the existing practices as part of the standard, but the question is does the pullback on spend limit your ability to expand to new accounts in any way, shape, or form? And I have a second question after that.
Sure. So maybe I'll jump in and maybe let Dustin add a little context and color as well. So first off, in terms of the trajectory, let me start by saying we're incredibly pleased with how well the RHA launch has gone. I mean, in a short period of time, we've validated the strategy and the execution of our commercial team that's out there and the quality of the RHA product line. We're also still looking forward to getting RHA 1 approved, which we also think will help going forward. So a couple macro things. The overall market dynamics continue to be really healthy. So, consumers engaging in facial injectables, that continues to be a really robust market. We think, Q4 and Q3, so that's all good. And then if you look at sort of the headwinds and the tailwinds, on the tailwind side of it, you've got ongoing focus on the RHA product line, which would have competed for a little bit of time, with the launch of our neuromodulator. So we'll continue to drive that. As you mentioned, Seamus, the number of accounts, we've talked about sort of going after the prestige category in the market, which is the top third, which is roughly, 15,000 or so, which we said we kind of get into roughly half of those. So we're kind of 2,500 along that journey, adding roughly 500 accounts per quarter. So we do think that there's still room to drive, ongoing penetration there. Countering that a little bit is obviously, we know that having a neuromodulator in our bag will also help unlock opportunity in some accounts. So again, tailwinds, we've got focus, we've got new accounts that we can open, and then headwinds, I think partnering it with the neuromodulator, but we are heading into sort of a strong season. And I don't know, Dustin, if you want to add anything to that.
Just a couple things. I think the strategy for our Revance Aesthetics focus on the account and not on driving consumers' loyalty kind of beyond the agnostic of an account has really resonated. That resonates well with RHA, and we get some lift on that. I want to address the spin question as well. We feel very confident that as we laid out those strategic priorities, we're able to make adjustments and resources to ensure that we're not choking the spin of the RHA line and investing in those things that have the highest return. It's a very good growing market for the dermal fillers, and we think that we'll continue to be able to drive growth. While it'd be great to have DAXI right now, we feel like we can utilize this time to focus on RHA, and the demand for DAXI is there. I get countless calls from doctors already asking when it's coming, as you can imagine. So we feel like we can use that momentum around the Revance Aesthetics strategy with OPUL and RHA to get us started and grow both new accounts as well as our penetration.
Great. And then just in terms of the planned filing for CD that I think we were anticipating this year, how should we think about the CRL, the manufacturing discussion points, and when you'll be able to provide us with a detailed update, on the overall sort of filing strategy in 2023? Will that come alongside the Type A, the post Type A meeting updates, or will that come, perhaps at a later point in time?
Yes, Seamus. So just to reset, sort of what we communicated on CD was to complete sort of the OLS program in 21, file in 22, approval in 23. And now that we've completed the overall phase 3 program, we are certainly in a position to be able to file that. Our strategy all along was to file this as a BLA supplement to the glabellar lines approval. We continue to think that that's the most prudent strategy and approach. However, given the linkage between the sBLA filing and the approval of our glabellar lines indication, I think the most appropriate time to give an update on that will again be after the Type A meeting, where we'll have more clarity and visibility.
Great. And then just one final question. Any visibility on the actual timing or kind of the regulatory timing of the Type A meeting itself? It was our understanding that it would be, probably take 2 weeks to request, and then 30 days post that to actually get the meeting. But, we're hearing about some delays at FDA, a lot of backlog. Just wanted to see if there was any, sort of a general clarity on that, that you might be able to provide, just even the outside possibility that this could be kind of an end of Q1 meeting is something that we're getting questions from investors on. Thanks.
Sure. Yeah, I'll go back to kind of Ken's early question. Again, what we'd indicated previously when we received the CRL, given that there wasn't any specifics in the CRL itself, we were hoping to get a little bit more clarity, which we now have to sort of refine, the meeting request, binder that we put together. So we think we've got that clarity to guide that filing. And then, we know what the statutory timelines are. Typically, it's 14 days for them to review and make a decision on granting a Type A meeting or not, and then that gets scheduled within 30 days. Certainly with the pandemic, I'm sure there are scenarios where that could get pushed out. We're hopeful that that will stay on track and on target. And again, our plan is to communicate, with clarity once we've had the Type A meeting.
Great. Thanks, guys.
Thanks.
And our next question is from Annabel Samimy of Stifel. Your line is open.
Good afternoon, everyone. This is Nick Rubino on for Annabelle. Thanks for taking our questions, and congratulations, Dustin. So you mentioned the double dosing regimens from competitors. What have you seen in the marketplace in terms of trends towards practices utilizing this method? And do you see the economics around this regimen potentially infringing on DAXI's value prop? And then just a quick one. Did the end of phase 2 meeting change anything about how you're thinking about the Juniper study going forward? I know it's kind of on the back burner for now, but just any thoughts around that meeting? Thank you.
Sure. So first on, double dosing, if anything, I think we look at it as sort of further credentialing of the long-acting neuromodulator opportunity. I think, if you go back in time, there was sort of a long narrative that, there really wasn't a need and patients didn't want it. But I think pretty quickly now it's coming to a point where people recognize that there's a real need in the market. And I think that, it's reassuring to see competitors starting to talk about the long-acting category. However, these products have been on the market for over 30 years, and a lot of effort has been put into trying to characterize different dosing and different ways of evaluating performance. So, until there's true phase 3 data out there that looks at it, we continue to think that in the absence of a differentiated formulation, it's going to be hard to match the duration profile matched with the safety and efficacy of our product. So we continue to feel like there's a huge opportunity on that. You mentioned the economics. Certainly, as you start getting into double dosing with conventional short-acting neuromodulators, you do start to bump up against sort of, what's the affordability of that. And as we've talked in the past, in terms of positioning, we think that there's an ability for us to get a premium and for customers to pay a premium and practices to make more margin. But we think that the economics with our product will work, whereas with some of the higher dosing, I think that's a little bit of a TBD. On the end of phase 2 ULS program, we were very encouraged by the feedback that we received from the agency in that end of phase 2 meeting. So we now have clarity around the phase 3 program that will be needed to move that forward and to ultimately seek approval for that indication. As Toby mentioned in his remarks, given sort of the need to prioritize the approval of the BLA, the ongoing sort of adoption of the RHA line of filler products and, getting OPUL out into the marketplace, we're going to pause sort of the phase 3 program. But, again, this is not an if, it's a when. And we will look to sort of resume activities around our therapeutics pipeline, once we feel that we're in a position to do so. But, again, very good end of phase 2 meeting with the agency, and we feel, again, we've got the clarity that we're looking for on our phase 3 program there.